When you think of a hospital, you think of a place to heal, right? But let's be honest, for most of us who've been a patient, it's anything but quiet. It's a constant storm of beeps, alarms, rolling carts, and conversations. It's this wild paradox. The one place we go to get better is often one of the loudest, most stressful environments imaginable. So that brings up a really important question. What if all that noise isn't just annoying? What if it's actually getting in the way of recovery? What if it's a real physical barrier to healing? Let's dig into that. To really get it, we have to understand what this, let's call it a symphony of stress, actually does to our bodies. Because this isn't just about being irritated by a sound. No, the impact is deeply physiological. It's about what happens to you on a biological level. And the effects are, well, they're pretty startling. Research shows all this noise can directly make your heart beat faster, it can raise your blood pressure, it floods your body with stress hormones. Of course, it absolutely wrecks your sleep, which then leads to patients reporting that they're in more pain. And in the most extreme cases, like in the ICU, it can even help trigger a terrifying state of confusion called ICU psychosis. Now, you might be thinking, okay, this is a modern problem, right? A side effect of all our fancy beeping medical technology. But what's fascinating is that the idea that quiet is essential for healing, it's not new at all. It's an old idea that we're just now starting to really appreciate again. In fact, let's go all the way back to the founder of modern nursing herself, Florence Nightingale. Her environmental theory was totally revolutionary. She basically said, a nurse's main job is to create the perfect conditions for the body to heal itself. And right up there with clean air and warmth on her list, you guessed it, quiet. She knew, just by watching her patients, that their surroundings were this incredibly powerful tool for recovery. And get this quote from 1860. She didn't mince words. She called excessive noise a form of cruelty. Can you believe that? Over 150 years ago, she understood that noise wasn't just unpleasant, it was actively harmful. Her words just give this whole issue so much more weight, don't they? Okay, so if we've known this for so long, what's the fix? Does this mean we need to spend millions on soundproofing or inventing silent machines? Well, as it turns out, the answer is way simpler, and honestly, way more powerful than that. So this is the big question, right? How do we take that incredible wisdom from the 1800s and apply it to a high-tech modern hospital? Well, the solution isn't some new gadget. It's knowledge. Just look at this chart. It's from a study by Althea Sanders. They took a group of ICU nurses and gave them just a 30-minute educational session on how to reduce noise. Before the session, their knowledge score on the topic was about 72%. Not bad, but afterwards, a perfect 100%. 100%. That right there is the aha moment. The solution isn't complicated tech, it's simple, targeted education. And this is so important to understand. The problem was never a lack of caring. Nurses are some of the most dedicated people on the planet. The issue was a gap in specific knowledge about how to make things quieter without compromising care. The solution was all about empowering them with that information. So what did that education actually teach? What were these simple, practical things that made such a huge difference? Well, it wasn't rocket science. It was a blueprint for quiet made up of small, everyday behaviors. I mean, look at these. They're so tangible. It's about being proactive, checking IV bags before the alarm has to go off, making sure electrodes are on properly so you don't get false alarms. And then it's about just being mindful, closing doors quietly, or opening crinkly packages outside the room during sleep hours. These small things, often bundled into quiet time protocols, have an absolutely massive impact. But a hospital is a complex place. And while these individual actions are fantastic, sometimes even the best ideas for improving care can have, well, unintended consequences. You end up with this paradox you have to navigate. A perfect example is the nursing shift report. The old way of doing it was the nurses all huddled at the nurses' station talking about patients. The new, much better way is called the bedside shift report, or BSR, where the conversation happens right in the patient's room so the patient can be part of it. And the reasons for this change are huge. One study showed that doing bedside reports led to an 86% drop in patient falls. I mean, that's incredible. Not to mention, it improves communication and makes sure everything's being done by the book. It just makes care way safer. But here's the paradox. This fantastic practice, which is great for safety and communication, brings more talking and more activity right to the bedside, often when the patient is trying desperately to sleep and heal. So the challenge becomes trying to balance two really important needs, keeping the patient in the loop and giving them a quiet, healing space. So after going through the problem, the history, the solutions, and even the complexities, we land back on one simple, powerful truth. A quieter hospital is a healing hospital. This isn't just about making patients happier or getting better reviews. It's a fundamental part of providing good care. And that kind of leaves us with one last idea to chew on. We tend to think that the loudest rooms, the ICUs with all the alarms, are where the most intense care happens. But what if we flipped that on its head? What if we started designing our hospitals and training our staff with the idea that the quietest room is actually where the most healing happens? What if quiet became the new gold standard of care?